In this video, I am going to talk about personality disorders. As expected, I'll begin by discussing about what is personality, and then I'll talk about what are the characteristics in general that could be labeled as personality disorders. This will be followed by the introduction of 3 clusters of personality disorders and discussion of their characteristics and clinical features, including each personality disorders. So let's begin. What is personality? Although there is not one acceptable definition of personality, but broadly speaking, that which distinguishes one individual from another could be called personality. You may already know that the word personality comes from the root word persona, which means mask or face. While talking about personality, the emphasis is put on patterns of behaviors and relations with others, rather than the physical aspects, which is of lesser significance. Now let's see another term, personality traits. So what is personality traits? It is surface characteristics, generalized predisposition to certain consistencies of behavior. Well, but the individual have other internal underlying aspect as well, like drives, needs, etc. So it is important to note that personality can also be described as either traits or by underlying tendencies, maybe in terms of drives, needs, constructs, unconscious mechanism, etc. Despite all the work carried out on the other approaches, traits remain the most current and comprehensive way of describing personality. In any one person, traits of the personality do not cover the whole field of behavior. Example, a person may be friendly, honest and tidy and careful, etc. in some situations and not in others. Traits tend to be associated with groups, giving rise to types of personality. Because of limited field of particular traits in any one person, it is therefore possible for individuals of the same type to behave differently in similar situations. Traits can vary in intensity and when sufficiently strong can be regarded as abnormal in a statistical sense. Extreme traits are less common than the average. However, at sufficient level, statistically abnormal level, they can then interfere with individuals' relations with other people. When they pass beyond the bounds of what is socially tolerable, they will be regarded abnormal in the sense of being morbid, cultural norms. Now, the question is, what is the importance of personality in counseling or therapy, or in any treatment process for that matter? The variations in personality are important because they may predispose to psychiatric disorder. Personality as predisposition. They may account for unusual features in psychiatric disorders, personality as psychiatric conditions, and they may affect the way patients approach psychiatric treatment. For example, adverse circumstances are more likely to induce an anxiety disorder in a person who has always worried about minor problems. Histrionic features suggesting a diagnosis of dissociative disorder may rise from histrionic personality traits. When such features are marked, diagnosis is difficult if the accurate assessment of personality has not made. This is an example of personality working as pathoplastic factor, which means unusual features in psychiatric disorder. Personality in relation to treatment. It is important determinant of person's approach to the treatment. Example, people with obsessional traits may become angry if treatment does not follow their expectations exactly. Now let me tell you a little bit about the types of personality. You all might know the concepts that Cattell proposed in 1963. He identified 5 factors. Similarly, Ising 1970 proposed scheme that originally had only 2 dimensions labeled extroversion, introversion and neuroticism. Subsequently, a 3rd dimension was added, psychoticism, which is a constellation of traits of coldness, aggressivity, cruelty and propensity to antisocial behavior. Other concepts on personality are 5 factors, OCEAN, OCEAN, etc. Also, regarding the origin of personality, there could be different bases for the origin of personality. In fact, they all work together rather than in isolation. Personality may have the biological basis like genetic influence. Studies of body build and personality studies of twins have demonstrated reliable proof of biological basis. Childhood temperament could also predict the adult personality. And importantly, childhood experience contributes a lot to personality development. You could look into Freudian theory, Jung's theory, Adler and Neo-Freudians etc. to get more idea on this. Another important aspect of personality is the assessment of personality. The means of assessment of personality used in everyday life cannot be applied reliably in clinical practice. In everyday life, we assume that current behaviors reflects the person's habitual way of behaving, the personality. And generally, this assumption is incorrect. The same assumption is often misleading when patients are assessed because the current behavior of an ill person reflects the effects of illness as well as the personality. The personality of an ill person can be evaluated effectively only from reliable accounts of past behaviors obtained wherever possible from informats as well as the patients. Now, let us get into personality disorder and the concept of personality disorder. Some personalities are obviously abnormal, for example, paranoid personalities, characterized by extreme suspiciousness, sensitivity and mistrust. On the other hand, it is difficult to draw a sharp dividing line between normal and abnormal personalities. It is even difficult to decide what criterion should we use to mark the distinction between normal versus abnormal. However, two types of criteria are suggested: statistical and social. On a statistical criterion, abnormal personalities are quantitative variations. It has implication in research, but limited value in clinical work though. Social norm: abnormal personalities are those that cause the individual to suffer or cause others to suffer. Abnormal sensitivity and gloomy personality causes suffering to the individual, and an emotionally cold and aggressive personality causes suffering for others. Another important question to ask is, does personality change during the adult life? Answer is maybe. There may be profound and enduring change in personality. This is not a temporary change in behavior like behavioral changes after person is intoxicated. Oftentimes, these enduring changes are accompanied by stressful events or illness. These changes may result from injury or organic disease of brain, severe mental disorder, especially schizophrenia, exceptionally severe stressful experience like hostage or prisoners undergoing torture. In fact, these conditions are given diagnosis. In ICD-10, change in personality due to organic disease of brain is classified with organic mental disorders in section FOO. F60 in ICD has enduring personality change after psychiatric illness. Now, let us try to understand the characteristic of personality disorder in general. Clinical features of personality disorder. There are certain individuals who do not display the obvious symptoms. However, there are certain inflexible and maladaptive traits that they are unable to perform some expected roles by their society. This state or case is referred as that this person is having personality disorder. According to DSM, the criteria for diagnosing personality disorder are: person's enduring patterns must be pervasive and inflexible as well as stable and of long duration. It must also cause either clinically significant distress or impairment in functioning and be manifested in at least two of the following areas: cognition, affectivity, interpersonal functioning or impulse control, impulsivity. Now, let us talk about categories of personality disorders. According to DSM-4-TR and now DSM-5, personality disorders are grouped in three clusters. Cluster A: these disorders often seem odd or eccentric with unusual behaviors like distrust, suspiciousness, social detachment. It includes paranoid, schizoid, schizotypal personality disorders. Cluster B. These disorders are characterized by dramatic, emotional and erratic behaviors. Cluster B includes histrionic, narcissistic, antisocial and borderline personality disorder. Cluster C. These disorders are characterized by anxiety and fearfulness. It includes avoidant, dependent and OCPD, obsessive compulsive personality disorders. Now let us look into more specific symptoms of these disorders. Let us begin with cluster A, which is characterized by often odd and eccentric symptoms. In cluster A, paranoid personality disorder. Person with paranoid personality disorders, they are suspicious. They see hidden meaning in innocent remarks, fears betrayal. Next one, schizoid. No close friends and aloof and detachments are the characteristic of schizoid personality. The third one, schizotypal. Social interpersonal deficits with 5 or more of the following, like suspicious thinking, strange belief, strange speech, eccentric behavior, unusual perceptions, ideas of reference, marked social anxiety. Now let us see cluster B, which is characterized by dramatic and erratic symptoms. In cluster B, the first disorder is antisocial personality disorder. These are characterized by irresponsible, deceitful, poor regard for rights of others, lack of empathy and remorse, violates social norms and exploitative. Second disorder in cluster B is histrionic personality disorder. People with histrionic personality disorder seek center of attention, often using physical appearance, often sexually provocative, seductive, emotionally shallow. They quickly assume more intimacy than exists earlier in relationship. Impressionistic thinking is one of the another characteristic of this disorder. The third disorder in cluster B is narcissistic personality disorder. This disorder is characterized by inflated sense of self, arrogant, deficient in empathy. They see self as special, sense of entitlement are the main characteristics. The fourth disorder of cluster B is borderline personality disorder, BPD. It is characterized by strong and chronic feelings of emptiness, mood instability, disturbance in identity, fears of abandonment, unstable, impulsive interpersonal relationship, suicidal gestures and self-mutilation. Now let us look into cluster C personality disorder, which is characterized by anxiety and fearful symptoms. In cluster C personality disorder, the first disorder is avoidant personality disorder. These disorders are characterized by inhibition with others, limitation in social contact. People with this personality disorder fear criticism and rejection. The second disorder is dependent personality disorder. People with this disorder want others to make decisions, fear taking care of self, and they are passive. The third disorder in cluster C is called obsessive compulsive personality disorder, OCPD. People with this disorder are rigid, preoccupied with details, perfectionist, have difficulty delegating responsibility. They hoard money, objects. Are there any difficulties in diagnosis of personality disorder? And answer is again yes. Let me conclude this video by discussing few issues that could create problem in diagnosing personality disorder. Diagnostic criteria of personality disorders are not as sharply defined as per most disorders. For example, in dependent personality disorder, goes to excessive length to obtain nurturance and support from others is one of the criteria, which could be misleading and confusing. Similarly, diagnostic criteria are not mutually exclusive. People often show characteristic of more than one disorders. Again, the conclusion is that there is a confusion and there could be a problem in the diagnosis of personality disorders. Thank you.